eye. Here are a few things you need to take note while taking your BP readings to get an accurate check. First and foremost is the environment. It must be cool and calm. Next is you ensure that the patient gets 5 to 10 minutes of rest before the check. Another is ensure the patient hasn't smoked, taken alcohol, or exercised 30 minutes before the check. The next is you ask the patient to sit upright, resting the arm for the check on a table. This will enable the cuff which you want to apply. This is the cuff. You enable the cuff you want to apply to be at the level of the heart. You apply the cuff on the arm, so it must be at the level of the heart. That's the essence of placing the hand on the table. The next is you ensure that you apply the cuff directly on the skin of the arm. You don't apply cuff on the clothing. You have to move the clothing upwards, nearer to the shoulder before applying the cuff. The next is the choice of your cuff. Very, very important. And means that should have come earlier. This, you have to choose a cuff depending on the size of the patient. For slim, very slim patients, they have their own cuff. Then for people who are on the very big size, they probably have their own cuff. Using the wrong cuff for the wrong patients or mixing up these cuffs can actually give a wrong BP measurement. Then next is you apply the cuff, taking note of the lower part of the cuff. Where you see this arrow here, there is an arrow here, that's the lower part of the cuff. Okay, this arrow should be placed 3 centimeters from the skin crease of the elbow, precisely. The skin crease of the elbow. So this arrow should be roughly 2 to 3 centimeters. That this lowest part of the cuff should be 2 to 3 centimeters from the skin crease of the elbow. Then before you can connect your cuff to your machine. This for those using electrical, BP machine. And there is the manual one, which you use stethoscope, essentially putting it at this space. If you are using the manual BP machine, your stethoscope will essentially be at this space. But if you are using the electrical, then of course the lower part of the cuff should be 2 to 3 centimeters from the skin crease of the elbow. Then very importantly is ensure that you take your readings at the same time in the day. If you are doing in the morning, make sure you're taking it at a particular time in the morning. In the evening, the same thing. Okay? And ensure that every BP checked is recorded along with the time. And keep this time fairly constant. And finally, and very importantly, is for persons who are diabetic, especially those who are having long-standing diabetes. It's always advisable, especially when they complain of dizziness, that if you check their BP while they are lying flat and 3 minutes on either sitting upright or standing. A significant difference in systolic blood pressure of 20 mm mercury and above and diastolic blood pressure of 10 mm mercury and above can be a sign of an autonomic nerve damage. So these are a few tips that you can observe while taking your BP readings to give you a fairly accurate reading.